The MP for Guildford says that urgent measures are needed to tackle the issue. Zöe Franklin said that new figures showing the number of patients waiting longer than 4 hours in A&E at the Royal Surrey have shot up nearly 900% over the last decade. She also found A&E attendances have risen more than a third from June and July in 2015 to June and July this year. I've asked her about her findings.
In June this year, attendance at A&E was up about a third, same in July. But the shocking thing is that in June, the number of patients waiting more than 4 hours, it was up by 9 times. And in July, it was up by 8.5 times. And I think we all know there's a winter crisis when it comes to the NHS. But to sort of be looking at this and going, crumbs, we're here in the summer, we're seeing increased wait times, that's really concerning. And the amazing staff at the Royal Surrey do a fantastic job. And they're working in really challenging circumstances. I think we're all really aware of that. So this isn't about denigrating the fantastic work of the Royal Surrey and its staff, but saying there is a problem here that the government needs to address, particularly as we head into the winter.
Now, we took your data to the Royal Surrey and to Surrey Heartlands, and they batted back pretty firmly, to say the least. The organisations they are that manages health services in Surrey. They've been quite robust. They say they're not happy that you've chosen data from a 2-month summer period rather than looking at a 12-month period. And that they said that comparing today's data with data from 10 years ago is particularly unhelpful, they say, because methodology has changed and so much in that period. What do you say to those?
So the reason we chose the summer period specifically was because we wanted to look at where we're at right now, knowing that we do have these particular challenges in the winter, which is why we went for that specific range rather than the whole year. And I think the reason we looked at the 10-year is to kind of try and illustrate to people the state of where the NHS has got to after 10 years, 14 years of Conservative leadership, and why the government really need to get a grip on addressing the challenges for the NHS so that the amazing staff can get on and provide healthcare for those who turn up at A&E because they really need it.
We've had a hugely hot summer. Do you accept the NHS's point that they tend to treat more patients when the weather gets really hot? Population's grown over the last decade and perhaps people are actually living longer. You'd expect there to be more strain possibly in the summer as well.
There will be these natural increases, but there's also the fact that we know for a fact that people are struggling to get a GP appointment, and we know that when people can't do that, they end up going to A&E for things that perhaps in the past they wouldn't have gone to A&E for. We've also got these challenges around dentistry. Again, we know that people are ending up in A&E for dentistry issues. So again, what I would say to the ICB, to the Royal Surrey, I am not having a go at them. What I am saying is that the government need to address with more money, with more training, for more available staff to address the issue that we have in the summer so that when we get to the winter, the NHS is not on its knees.